Ready? The meeting of the Dundee Township Mental Health Board is now called to order for February the 13th, 2025, time being 7:01 p.m. Daylight Savings Time in the Central Time Zone. Acting Secretary, please call the roll.
Adami.
Present.
Auger.
Present.
Connell.
Present.
Corrins.
Present.
Kempf. Thrower. Avlar.
Present. Do we have a quorum?
We have a quorum.
Very good. Will all please stand for the Pledge of Allegiance. Member Corns, would you like to lead us, please?
Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Amen. Chair will entertain a motion to approve the agenda as presented.
I'll move.
Second.
Moved by Auger, seconded by Corrins. Any discussion? All those in favor, please signify by saying aye. Aye. All opposed, same sign. The agenda is approved. Chair will entertain a motion to approve the meeting minutes of February the 13th, 2025 regular meeting.
I'll move.
Moved by Auger,
Second.
second by Connell. Discussion? There being none, please call the roll.
Adami.
Yes.
Auger.
Yes.
Connell.
Yes.
Corrins.
Yes.
Avlar.
Yes.
Minutes are approved.
Minutes are approved. Chair will open up to public comments. Is there anyone wanting to give public comments this evening? Seeing none, we will now go to the coordinator's report. Mr. Sanchez.
Okay, this is slightly revised from what was sent out the other day, just some additions that occurred in the last day or so, so I didn't have a chance to send it out to everyone. But we'll go through this here. Lost hours, as you know from the weekly document I send on task updates, 45 of the 60. So those will get caught up in the next few weeks or so. And then going forward, when I'm able to increase my weekly hours, I will start to bank those extra hours so that when I do need that time away for illness, family things, vacation, whatever it is, they'll be there instead of having to play catch up to those hours. That's something Mr. President Avlar and I discussed going forward, just so we can avoid any confusion or issues around that. So if there's any questions on that, I can talk about that. Police social worker program. I know we've all been really looking forward to this. We've been putting a lot of time and effort into putting it together, a lot of meetings. The main linchpin that has kind of held things up a little bit is how much space does the Carpentersville Police Department have to house an extra employee? One of the constraints that was given to us by the current police social worker is to have this new employee on site. Whether that might change over time, it remains to be seen, but that was one of the things that was discussed pretty early on, is they want to have that person on site with the police department, accessible to the officers, developing relationships, able to answer questions easily, things like that. Well, they just recently had some big promotions in the department, which is a good thing. McKenna, the police social worker, her boss, was one of the ones that was moved up, and another, I can't remember if it was sergeant or commander, I forget the terms. But essentially now, because of that, there has been some reshuffling of office space, and the police social worker McKenna had a decent sized office that was going to be split in half to house the other employee. Now she has been moved to a smaller office. So they currently don't have any space that they know of that can house this extra employee. So for right now, according to Police Chief Shaver, the expansion of this program is on hold. We're not walking away from it. It's still something that is desired. He has had a chance to talk to other chiefs in the area to on their level to make sure this is something that everybody does want to participate in. So we're just kind of in a holding pattern with this, unfortunately, until they can find some space. I know that the village of Carpentersville is working on expanding their whole village hall and police department, fire department, but that is a building construction project that is probably going to take 2 or 3 years to be complete. So they will be building into that, factoring into the space needs, some extra space for this program. I know Village President Skillman I've talked to recently, and he said he might be here tonight, but I don't see him here in the audience. If there's anything he's able to do to help facilitate this, he said he would as well. But for right now, unless they can find a way to house the extra employee offsite somewhere, the program is unfortunately going to be on hold. One of the other big ideas that came from talking to the police chiefs was the supplementation of crisis intervention training, supplemental funding for that. So I think that is a good avenue for us to at least start to pursue now that the police social worker program is on hold. Chief Green from West Dundee is very knowledgeable in that department and said he is willing to help in any way that he can to help us do that. And Chief Shaver, when I spoke with him, he was also interested in the idea. So that's something that if this board is interested in, I can start to pursue with them. We can do a very simple analysis of how many police officers in each department have this training already, how many remain, and then from there we can start to facilitate a training session up here instead of having the officers go down to Springfield. That was the idea Chief Green came up with because he knows the people that do the training. It's state run. It's a state level certification. It's a 40-hour training, so it's Monday through Friday, 8 to 4 kind of thing. So it's something that if this board is interested in, we can begin to pursue and look at the feasibility of that and talk about how much funding you would want to make available for that. Any questions on this?
Member Auger?
Yeah, so I guess I'm disappointed that we're going to be blocked on this because of space, an office space. I guess I'd like to see some additional discussion to figure out other alternatives. I mean, I appreciate the need for the police social worker to be able to perhaps communicate, or not perhaps, but to communicate with the police officers and develop a relationship there. However, I would tend to think there's got to be some space around, whether it be in the fire department or other police departments in the area that might be able to support something like that.
That's the other question I had jotted down too. Has there been talk, for instance, doesn't the county now have a new north end building on Point? Is that open? Is that potentially a possible alternative?
In Elgin?
It's on our side of, it's in Dundee Township.
Yeah, you're saying the one that with the health department and.
Right. I'm just looking for options here. I mean,
Yeah.
Well, again, I guess if the position doesn't have to be on site at Carpentersville Police Department or one of the police departments, I think that really opens up the conversation of housing the employee. I mean, maybe there could even be a trailer that is placed in the empty part of the parking lot at Carpentersville Village Hall even. I mean, there are many other opportunities that could arise if that is the case. So I think certainly part of this is going to be follow up with the social worker, McKenna, to see, okay, is there a way we can make this work without that employee being on site? Because it's been a constraint that has been part of the conversation the whole time. So if that does change, we can go off site with the employee, then I think we'll be able to move on this pretty quickly. Because where there's a will, there's a way.
I recognize the Carpentersville Village Hall is good 47 years old, and I don't know when the last time it was expanded. Mm-hmm. I know they have they might have to get to the point, if they cannibalize community rooms, at least one of the, they have a small one and a big one, if they haven't done that already, just to convert for office space, because I still feel this is a need in the township that we obviously had 2 to 3 year plan. I know they're not saying we need to wait 2 to 3 years, but I agree with President Pro Tem Auger that we need to think out of the box and let's try to find an alternate plan for this.
Yeah, and like I said, this is on hold, so the conversation will continue and come back with what can we do now? Can we go off-site? Is there some? And like I said, Village President Skillman said he's going to see if there's anything he can work out for us. So we just spoke the other night, so I'm not expecting him to have any answers yet. But hopefully soon, by our next meeting, if there's something we can do, we'll have that answer.
Okay. Any other questions for the coordinator, Member Adami?
Yeah, I just have 2 comments. Well, I guess one question. One comment is the impression I'm getting is that police department doesn't have the bandwidth to actually pursue this position, which is they're going to need to be driving it. So if they're right now saying or indicating it's on hold, then I would kind of respect that judgment call, because it doesn't seem like this is something that they can pursue, whether it's because of space or other issues. So I would ask questions, but I would let them come up with the solutions,
Sure.
not just say these are the options that we have or we thought about. So
Yeah.
I would let them kind of guide that conversation. The second thing, in terms of crisis intervention training, I'm wondering if Pivot Counseling, I know they're probably not certified to give the 40-hour training for a certification, but they did say that one of the things that they are passionate about is training first responders. So I'm wondering if they would be able to, we'd be able to utilize their services, which we're already giving them funding for.
Yeah, so I didn't have a chance, Lindsay from Pivotal and I were actually speaking today. We finally got a chance to talk and get caught up. They're going to be working with first responders to see what their needs are and setting something up for them. It won't be, crisis intervention training, but along those lines, I think is already something that's discussed. They've been speaking with some other libraries and other agencies as well, but first responders is definitely high on their list.
Yeah, because if they could, cover some of these topics, and it's not something we necessarily need to spend more money on, I think that'd be wise for us to utilize their knowledge.
Okay. Member Corrins.
To that point too, I was curious with the crisis intervention training, is that something that all officers go through already as part of their training, and then this is like a refresher course, or?
No, actually, it's not a requirement, so it's something that police departments have to pursue, but it is state certified. But there is a waiting period for new officers. I think it's about 2 years before they're allowed to take the training, because they want the officers to get in there, learn the job, get some experience, some real world experience, and know what it's kind of like out there, and then go through the crisis intervention training so that they're not just kind of getting confused with all these things. They're solidified in their duties. They're used to the routines and the regulars and the things that come up, and now they can add this other component to it so that when they have somebody who they can identify through that training, they know what to do, instead of just being a police officer that is, I've got no choice, this person is aggressive and I have to use force, which nobody wants, right? None of them. So
It seems like they should get that training right off the bat, but it's counterintuitive.
yeah, I thought the same thing, but when speaking with Chief Green, he said I think they started off doing it that way, but it was just kind of too confusing. It was like multiple streams of philosophy going on, so it was like, just do the regular, training, get in there for a couple of years, and then come back to the crisis intervention.
One of my questions too so I know we were pursuing the police social worker position, and I think with Belinda, I could see your point in like, we don't want this more than they do, and be forcing this upon them. I was always curious, and I know staffing wise, I don't think we have the bandwidth as the village to like house that employee, train an employee, have that ourselves, but I'd be curious if that would be an option, or if there's other, again, kind of space that would be available for just more of a community social worker, not necessarily like a police social worker, but just someone that, provides counseling and resources and support either through like the library, through the park district, through the village, or other avenues.
Yeah, well, I do know that the police departments want the expansion of the program. So that's settled science, essentially. It just is, the space issue is where it's at now, at least how I understand it. So, but I think that...
Sleepy Hollow and Dundee, the police stations don't have space?
No.
Okay.
That's...
Have they reached out to Algonquin?
Algonquin, no, because they're included in the McHenry program. So we haven't included them yet in that, because then that is another level of complexities that we would have to manage, as far as if they're going to be involved in the Dundee Township program, are they going to be divorced from the McHenry County program? How does the dispatch work with that? Because I think they're on a separate dispatch system. But we could ask.
I think it's a question that should be asked.
At least should be asked. Let's find out if they have space, if that might be the beginning of a viable alternative, and obviously the other questions about McHenry County and covering the Dundee Township portion of Algonquin we'll be able to answer. Let's just first see if they have space.
Okay.
One other question on CIT. When was the last time the standards were updated for at least 2 years, and who sets that? Is that the state?
That's the state. I'm not aware of when they have created those standards.
Okay, because I'm curious because it's all down. What was that, Member Adami?
I'm wondering if this is like the CPI training you get in hospitals. I don't know.
Okay.
I don't know
It's specific to law enforcement.
Okay.
So I don't know. It probably is different than that, I would guess.
One other possible, I'm curious, and I have not read this end to end, but also the recent Massey Commission report, if they have a recommendation to up the CIT training to either year one or maybe even day one. That might be interesting to check out, but that's something I can do offline.
Okay.
We've got enough things going, so I will check into that.
Okay. Any other questions on this one? Okay.
Did they give you cost for the crisis intervention training?
No, we haven't got that far in the conversation yet. So I wanted to, since, we're kind of having to pivot or just this is on hold, I brought it up with Chief Shaver and there's interest there. I think everybody sees the value in the crisis intervention training as well. So if this board is interested in pursuing that, then I can start those conversations and get into those details.
Okay. Are you done with the report? Or you have
I still have some more.
So, well, let's, before we move on, so Coordinator Sanchez is asking for our opinion on whether to pursue it. If we're entertaining an opinion, I'd be happy to share mine.
Go ahead.
I would wait on pursuing that until we've had a final discussion on the police social worker program.
Okay. Member Corns, thoughts?
I mean, I think I'd be curious to gather more information, and again, even talking to Lindsay, like, would some of those training opportunities be sufficient and, in the time frame that we're given this year, right? So, like, maybe that's something, if it's needing to be pushed later.
Okay. Member Adame?
I would pursue it further only because it's two different programs. One is more directed to the first responders and the other one is to the community. And so I think I wouldn't pursue the police social worker one again unless they reach out again. But I know it's important to ask these follow-up questions, but I would pursue gathering more information on the CIT training.
Member Connell?
Nothing.
All right. My 2 cents for what it's worth. On police social worker program, that clearly is the priority, as Member Auger pointed out. But let's research the possible options, and then once we run out of options, or if we get to that point, then at least some preliminary research into CIT.
Okay.
Not putting a lot of resources on it, but at least start gathering facts. Go ahead.
Okay. We have a list of things that we want Coordinator Sanchez to do. So I think we need to make sure we're prioritizing this additional investigation appropriately.
Okay.
I guess not to influence or say what I think you should do, but I do see that we have some follow-up for the police social worker program. Both of these programs we could be, funding in parallel, but as far as initiating them, I wouldn't want to initiate both at the same time. So if you're comfortable, I will pursue the police social worker program until we know definitively it's a dead end, at least for the time being. And if that is the case, then I can transition into the CIT research if that is, you guys are comfortable with that.
Okay.
Yeah, okay.
Obviously, the priority is
But keep the priority on the police social worker.
correct, and
Yeah.
obviously some additional fact finding. Member Connell?
Is this chief's going to come in here and start talking to maybe and asking questions and what we can actually offer them, or vice versa? I mean, they can train us, but they get through what they go through.
I mean, if you wanted them to come in
Because
and
I talked to Chief Green off the cuff, and he said he has no problem coming in.
Yeah, I mean, sure, they're always happy to, share information or send somebody in. But obviously, these ideas came to us from them during like the roundtable discussion. So.
Okay.
Okay, good. Go ahead and continue your report.
Okay. So President Avalar asked me to give a little update on the capability maturity model integration, the CMMI, that we really haven't discussed since last year. So just kind of a little refresher. It's more or less a template for assessing the capacity and the maturity of an organization. How much can an organization take on, and what level of maturity are they? I guess, are they new, startup board, as Mr. Avalar would say, or are they, like IBM, or they're functioning at a very high level? Or is IBM still around anymore, actually? Microsoft, all right. 5 maturity levels: initial, manage, define, quantitatively managed, and optimizing. It is designed more for businesses and corporations, but it's adaptable for a board such as this. Many organizations, they do exist at level 2 and they function, they get by. That is, as you see here, it's more project level based. You're planning things, you're measuring things, you're performing, and that is certainly where this board is at right now. The main goal right now, at least, is to achieve full level 3, where you're being more proactive, Your processes and procedures are very well defined. That the tribal knowledge that everyone here has, if we were to walk away from this board today and all new people were to come in, would they know what to do? And if the answer is no, then you're not at level 3 yet, or at the full scope of level 3. And so that's the idea, is to get this board to a point where anybody can walk away. There's a manual, there's a guide, there's a set of processes that a new set of people could come in and start to continue the work. So we are still in between levels 2 and 3. As I started to really dig into CMMI and assessing an organization for their levels and what they might need to do to advance to the next one, it's not a rabbit hole, but it does become pretty complex pretty quickly. So I started to spend some time doing that and realized for the scope of this conversation, I wasn't going to be able to really complete an actual assessment, but I have started to work on that and adapt what is used professionally to use for this board, because not all of the things in the assessment are relevant, like purchasing. We're not buying goods and things like that. I mean, there are many things that we can use, but many things we can't. So I'm still kind of parsing that out so that we can actually have our own version of a quality assessment of this group. Part of that, I think, we need to, because there is the interest to utilize this model, and I don't think it's a bad thing. I think it's good to have some kind of structure that can continue on beyond this session, but we should kind of create some objectives that are time bound for when we want to achieve level 3 or certain, once we have really the checklist for the levels, how much of each level we're going to accomplish by a certain period of time. So we'll need to develop a program plan. I think that would come from myself working with Mr. Avalar and Mr. Auger, primarily bringing that to you all for input as well. And then planning and scheduling tasks around that. So that's something that we can develop as we go along.
Okay.
And incorporate into like the work that I'm doing, and then maybe there would even be opportunities for board members to help with some of the work as well. Some of the organizational tools that we have discussed to some degree, but certainly going over this material again, it highlights the need for them. We're using things like Office 365 and Zoom. Project management, I'm starting to use Smartsheet for myself. It's something I encountered when working at Kane County, but I need to go beyond just what I have been using. So this has actually become very helpful for myself. Data management, we've talked about SharePoint. President Avalar and Mr. Auger, we had a meeting recently. We talked about actually really pursuing that because that's going to be very helpful for storing documents, either temporary or long-term, making it easy for board members to access information that we're not necessarily wanting to put on the website just because it's not relevant for public discussion. But if there's something you need to review for the meeting, I can put it up there. There's a link. The website we have currently is very prohibitive. It's very clunky. It's not designed for that type of use. Process documentation. There's something I've encountered recently called Scribe, but there are other services that I might look into as well. But essentially, what is the process for processing an invoice or creating the agendas or all the things that my position does and the board does? You can do it on your screen. It captures it. It records it. It spits out like a printout, document based on that, and it's something that can be updated regularly as needed, but it lives on continually as new people come into the organization. And then for grant management, Foundit is a very popular one with a lot of mental health boards in Illinois, at least. So that is one that we're most interested in. There are many others, but because we know so many of our partners are using Foundit and successfully and happily. When I first came on, we were looking into it and we saw costs that were very high, and I researched it more recently, and I don't know why we were seeing costs so high. It seemed prohibitive, but when I looked at it, it's well within our reach. So SharePoint and Foundit for sure are two things we would want to set up appointments with them, tell them what our needs are, and then they would help us kind of craft that initial setup, that initial template or format that we would carry on. So there would be a little cost and time involved, but once it's done, it's a vehicle that you just have to put a little gasoline in every now and then. So I would suggest going in this direction with the CMMI model. We develop the program plan, use that to establish schedules, timelines, deliverables, but then we kind of come back every 6 months and assess where are we at, what check what boxes have we checked, how close are we to level 3? As I said, it is a bit involved. There's a lot to it, so.
I want to also, especially for members Adame and Corins who are not here, this started back in 2023 when we assessed, well, what is a good standard to know that this mental health board, to meet the needs of the patients of Dundee Township who use the services, where are we at? We are really mature and can more quickly help residents in the township. You can't build a house without a foundation. The foundation, the reason the capability maturity model for integration was used is it's based on a very tried and true 40-plus-year-old, originated from the Department of Defense through Carnegie Mellon, that can be reapplied. And I know various consultants will try to put their own flavor of it, but I asked Jarrett, and certainly we as a board discussed back in 23, well, instead of trying to reinvent the wheel, let's see what we can do to adapt this one as quickly as we can. And many organizations from startup do not get to level 3 until a few years later. Obviously, we want to minimize that time, but that's where we got into this, why we want for the long-term ability for this board to support this township and its residents. We need to be mature. Everything needs to be documented. If somebody walks away, because right now a lot of knowledge is in people's heads, and that's not the way it should be. It's got to be documented. It's got to be, we have policies. We started working with the township board to also adopt rules, because our governing board, we need to be able to apply, just for instance, with communications and with the video recordings. We want to be in sync, and it starts at the governing board, but what is purely our purview, we want to be mature and respond to the community as fast and efficiently as we possibly can. And if we set a best of best, that's great. And I want us to get there as soon as possible, but obviously we know we can't just say we're there and yet not be there. So any other questions?
And that's it for the report.
Okay, any questions overall for Coordinator Sanchez?
Is that the last slide in the presentation?
Yeah, there are other slides that are for other discussions later in the agenda.
Okay. For our next meeting, can you provide us an update on the goals? So we had 5 goals. I think it's important that we assess those goals, whether we met them, didn't meet them, exceeded them.
I think some of that's going to be discussed in the annual report.
Okay, but I didn't see anything in the annual report that really discussed.
Yeah, so the other slides with the timeline, the reason I didn't include is because there really wasn't any significant updates, and we pretty much put what we could into the annual report. But yeah, that will be in my updates again next month and going forward. So waiting for the new one-year plan to really kind of reformulate that.
Okay. If there are no other questions or comments, we'll move on to the financial report. Chair will entertain a motion to approve the list of bills of the December, January. Is February supposed to be on here?
February we actually approved.
We did approve, okay.
Yep.
So December, January, and March financial reports. It's presented. Do I hear a motion?
I'll move to approve.
Moved by Augur. Is there a second?
Second.
Second by Connell. Discussion, Mr. Sanchez.
We have our first invoice from this grant year from Family Service Association. I think it's still pretty in line with what we were seeing the last half of the last grant year. When it first started, the numbers were higher, but the health insurance requirements for mental health kicked in, and we saw their numbers going down and existing around this level. So that I'm guessing is what we're going to see for the remainder of the year, is somewhere around that average monthly. Our ACMI membership dues, those are annual, and then the ACMI conference reimbursement for the hotel stay. We haven't received the invoices yet for Ride and Cane. We did get the activity reports, but we still are waiting on the invoices. So that's why you don't see those here this month. But other than that, it's pretty straightforward. If you have any questions.
Any questions? Member Augur.
So for FSA, so they've provided us their first invoice. When are we expecting to get invoices from other service providers?
Hopefully we'll have them in time for next month's meeting, because most of them are on a quarterly
Okay.
invoicing, and we gave them till the 15th of the month. Most of them said they would be able to have it well before the 15th of the month. So assuming that timing works out, then we'll have a few, we should, fingers crossed, have a few more next month, but FSA should be monthly going forward.
FSA is monthly, the rest of them are quarterly.
Yeah.
Okay.
And quarterly means based on the calendar quarter, which means
Yeah,
April. So they have the quarter has to end first, and then we'll see it, possibly by April 10th.
Yep.
Okay. Any other questions or comments? If not, please call the roll.
Adame,
Yes.
Ugger,
Approve.
Connell,
Yes.
Corrins,
Yes.
Thrower,
Yes.
Avlar.
Yes. It's approved. Next on the agenda, we're going to move into the discussion of the one-year plan for fiscal year 2026. Mr. Sanchez, and please let us know which handout we should be looking at.
Well, you can look at either of them, but there's the one that's the clean one that just has the red, which is the additions that were provided by board members. The other one just has what was the old text that's struck through. So
Okay. So I think the front and back is the clean text.
the one pager is the
Just to make
clean
sure we're
one.
literally on the same page.
It made sense to me when I was putting it together, but now I realize it might be a little confusing, so I apologize. So I will just kind of walk through each of these sections, ask for feedback. Starting with the mission, this was a suggested change to make. Is there any thoughts on this?
Any thoughts?
If this is something you want to adopt, I know Mr. Auger, I believe you developed this language. Was this to replace or to be in addition to the mission as it is now?
I believe it was to replace.
Okay. So any thoughts on, and Mr. Evler, would you want to just go through each section and just kind of get a consensus from everyone if they're
Yes, yeah,
agreeable to
because
the
it's
changes?
not,
or-
it's not on the agenda as a motion to approve, it's simply a discussion. The approval should probably come at the April 10th meeting. So do we have a consensus for the new mission statement? Seeing no objection, we'll move on.
Okay, goal 1, improving communications with the public. Here we have revising the communications plan, holding stakeholder meetings. Just switching the language from something that was a first time to now something that is going to be more iterative. Regularly posting relevant information to social media, educating the public about access services. So some of the questions here, so for holding stakeholder meetings, asked attendance goals and publicly posting the dates. Well, for attendance goals, ideally we want 100% attendance, but obviously it's hard coordinating everyone's schedule all at once. And Mr.
Member
Yeah. So we built into the work plans an expectation that service providers need to attend.
Yeah, for service providers, that is built in the work plan. Not in the work plan for the law enforcement,
Right.
the legislators and
Understood.
others. But yeah, I spoke with one of our service providers today who kind of misinterpreted and thought they had to be at the regular meeting. So I clarified that it was the stakeholder meetings that we're asking for attendance at. So that for sure is in our contracts with the service providers. As far as publicly posting the dates, we're not going to do that because these aren't public meetings. They're invite only. We don't want everybody showing up. We're not interested in having the public there. We have reports after, but these are the conversations. We want everybody to speak freely, and then the work that comes out of those meetings is what we bring to the public. Because again, we have our needs assessment that has provided a lot of guidance for areas for this board to pursue programming. But from that process of the needs assessment, these stakeholder meetings grew. And that's where we're starting to glean more information, more identification of needs in the community. So it's not everything is in the needs assessment. This is the ongoing process. Posting information to social media. So some of these, I think, I would ask for a little guidance or suggestion on maybe more specifics. So this is a good one. How many posts per week, right? Would you want 2 posts per week, which is what I would recommend, and that will get worked into my weekly work plan, because social media, it's been kind of like hit or miss. But I think for all of these bullet points underneath, let's look at them as objectives that if we can kind of pin down a little bit more specificity, that would be good. So if that's something you guys would want, like a certain number of posts per week, at least 1, but would you want 2, something along those lines? you know,
Start with one.
You want to start with one?
I would start with one and then we
Yeah.
can build from there.
at least just have one. Okay,
We'll start with one. We can always change it later if we need to.
sure.
Because obviously there's going to be some weeks where there's going to be no new news, like a holiday shortened week or something like that. So-
Sure, yeah. Okay, so for point 3 here, educating the public about access to service and the work of Dundee Township Mental Health Board, and the question asked was how. This one just seems to me at least a bit vague and is kind of something that is really a part of the communication plan. So, Mr. Unger.
So we specifically contracted with Pivotal
Mm-hmm.
to fulfill that need. So that's how it's going to get solved. Or
Okay.
part of how it's going to get solved.
Did this come up in your recent meeting with Lindsay or phone call with Lindsay?
What do you mean?
As far as,
Well, I mean, that's
How
what
to
their program is education.
so.
Yeah.
So this early on, are they on track to begin that? And we can keep that as a goal. That's the how, is the pivotal. And
Well, one of the ones, there's some other things that we can entertain that we don't have to go into a lot of detail here tonight on.
true. A good point about bringing up pivotal. Anyone else?
I saw McHenry County, they have like, I went to I think it was the Crystal Lake Library, and they have flyers with QR codes.
Yeah.
And then you use the QR code and it kind of like pulls up all these resources from their website.
Yeah.
So I'm thinking maybe we could do something like that. I thought it was really interactive, it was cool.
Yeah, and that is something that I had started in talking with police chiefs. They wanted a kind of easy to use resource guide. Kind of grew because then now we have a bilingual population here largely, so having access into languages and things like that. I think going forward, as far as the website, you know, how you guys want that website to be utilized, that's, you know, a good question. I did start looking into alternatives for websites that are maybe going to be a little more design friendly and ease of use, that have a little more functionality, but I don't know if that's a direction the board would want to go in. Might be better to keep it just uniform with the main government website.
Yeah, I mean, I oftentimes research other mental health boards just for my own clients, because they usually have a list of like local providers. And since I service pretty much anyone in Illinois, I don't know other townships and their services. And so I usually go on there before I meet with them, just so I have an idea of where I could refer them if needed. And so I think really, as long as we have a list, it's helpful. And we could always improve how it looks, the appearance, as we go on. But as long as we start off with the list, a couple of service providers that we're contracted with right now, I think that would be a great start.
Member Auger?
So to answer your question, Member Adami, we already have a list of over 70 providers in the inventory that was provided to us in the needs assessment. Further in the needs assessment, there's probably about another dozen or so service providers that residents identified they use that should be added to that. So it would be a matter of, you know, providing that link.
Yeah.
But we have it, is I guess the point that I'm making.
Yeah. Yeah, I guess mine is accessibility, like just a QR code or
Yeah.
something that pops up, you know.
Okay.
There is something on this one I wanted to bring up. With websites, you know, you create a URL, you know, domain. You try to keep it simple, something that's easy to re-communicate. Our website right now is off of the main DundeeTownship.org website, so it's a little clunky. So I don't know if there's any interest in the board with us having our own domain name that just, it links right to the current page. But it's instead of communicating, go to DundeeTownship.org/708board/PHP or whatever, it could be, you know, Dundee708.com or .org, and that's, you know, so if that's something you guys are interested in, I can put that together quite easily.
Go ahead.
Simple answer, no. We have too many other things right now that are of higher priority than redesigning an entire website. I mean, if we're going to go down that road, we need to contract out with somebody.
No, I'm not saying design a new website. I'm saying just to
Right.
have our own domain, like a 708, Dundee708.org, that then
So it's like
refers to the current
you would
page.
just go to GoDaddy
Yeah.
and buy it.
Yeah.
but
I know how to
there-
do it.
this- Yeah, so there's no work except the $12 that it costs to buy the name of the website. It goes directly to our current website.
And I don't we can have a discussion about it, but I don't understand how that's gonna benefit us.
Yeah, it's just, I think for marketing purposes, I think Jarrett, maybe, I don't want to speak for you, that it's just cleaner because we can say something like Dundee Township mentalhealth.com instead of, the longer address on stuff. So it's just for marketing, but nothing on the back end. So it's just buying a name that links to what we already have. You could buy 10 names. You could buy
Sure.
Township 708, whatever you want.
Yeah, it's really just for marketing, so that if some, even posting online, go to dundee708.org instead of go to dundeetownship.org, and then go to the mental health tab and search for what you're looking for. So it's just an idea for, again, that marketing component.
Okay, Member Corns or Member Connell, any additional on this? I see where Member Auger's coming from. I think when we cross that line to level 3 maturity, that's where we'll be at a point to where, even for just for marketing, because this has to be managed, and it has to be managed efficiently. And I think it's too soon for us to even go, even if it's just a simple domain name. I think it's too soon. We know our neighboring mental health boards, particularly in McHenry County, they have their own domain. They have their own servers too. If we get to that point, but we gotta get to level 3 first, in my opinion. So I'm kind of more with Member Auger on this one. It's a good idea, but not right now.
Okay.
Maybe not for a 1-year plan. That probably should go to the 3-year plan. Make sense? Okay. Okay, continue on the communication.
Bilingual resource materials, setting a goal maybe for December 25. We don't actually have our own resource materials, so I don't know if that was the original intent of this objective, was for us to create resource materials and then also have bilingual ones. Our website obviously has a translate function. They're not always precise. If we had our own brochure or something like that, we would want somebody who's a native speaker to be able to translate it for us. But yeah, so I don't know what your thoughts are on this one.
Board, any immediate thoughts?
Personally, I think it's just connecting individuals to existing resources and putting them on our site. For example, I think I had shared with you early on, in case of an emergency, and I think that's on there now, in case of emergency, it's in Spanish also. So I think something along those lines, not reinventing anything, but it's providing a source. And with the QR code example, the library also had it in Spanish and English. So you clicked on that URL code and then it just, like QR code, sorry, and it provided services in Spanish. So I thought that was awesome. So I think that's what I'm thinking of. I don't know if anyone has any other thoughts.
Anyone else?
I mean, from going through the website, the nice thing about the website that we have it right now is it translates not just into Spanish, but it translates into a very large list. So I guess what I'd be interested in finding out is which of our documents do not translate using that capability, and then finding out, is there a way that we can structure the document in a way that it can use it. So like, for example, if it's a PDF file, that we're putting up there and the PDF file can't be translated, well, is there a different way for us to store that information instead of as a PDF, which would allow it to readily be translated by the tool we already have, rather than going out and having to invest in individual one-off translations for documents.
Any other thoughts?
I guess for me, resource kind of stands out, resource material. So my idea is quite simple. If you put out a flyer in English, just make sure it's in Spanish. If it's a PDF, if it's available. Like NAMI, they have a lot of resources you can download for free, and it's in both Spanish and English. And so that's my thought.
And for events, when I'm sitting at a table, I do have like a one-pager, and I'm going to make a Spanish version of that as well, like for that Meadowdale Elementary event that's coming up in May.
Okay, and I want to make sure we as a board agree, is the immediate second language is to be Spanish? That's based on the census, based on the population, we have empirical data that says it should be Spanish. So I just want to make sure we're all on the same page on that. Obviously, some questions may come up with other languages. Well, I think that has to be backed up by metrics as far as, is there a significant population in the township? And right now, I haven't seen the evidence of that, so. Okay, continue on. Any more on goal 1?
And then point 6, conducting a mid-year survey. That was obviously discussed last year as far as doing a year-end survey, but the board determined it was just a little too soon for that. So I'm thinking this is probably something you would want to put into motion June, July, somewhere around there.
Put into motion, but the survey is conducted at mid-year of the fiscal year, so that's more August, September.
However you would want to
Okay.
pursue, whatever timeline you'd want to pursue.
Okay. Member Auger?
Yeah, so for this, we delayed doing the survey in order to give more time to let residents absorb the service changes that we've made. As we're entering into planning for our 2026 program year, I would like to see us have that information sooner. I would actually advocate for trying to get going on this, selecting some candidates in April and then picking one perhaps in May so that they can get going and hit the road running. Because it's going to take some time to conduct the survey and then analyze the data and provide the report. So I see this as urgent for us to be able to fulfill our 2026 program year work.
Okay. Any other feedback?
I think, well, I remember us being conflicted as far as like how we would do that or what we would utilize for the survey. So I'm curious, like if we want to move faster, is there a leading to like what works?
Anyone else?
Yeah, I mean, if that's a question to me, NIU would be the default, but that's not to say we can't look at some other sources. NIU's familiar with our data set. We've used them. We've got a cost estimate. Clearly, we don't have the capacity in-house to conduct a survey like that.
What do you think, earlier than, say, first quarter of the fiscal year, is that doable goal?
Yeah, if you want the survey to be underway or near completion by June, July, then we definitely want to get started March.
Yeah.
Or, yeah, pretty much now.
So instead of conducting mid-year,
I'm on, last month I was on March, this month I'm on February, okay?
all right, so we'll conduct, so
It's a
basically
Tuesday.
a quarterly a first quarter of the fiscal year instead of the mid-year of the fiscal year, and have completed by the end, by mid-year. So if we need to reword that for communication clarity. All right. Any other feedback or comments on goal 1? One minor change, I would say, let's go ahead and use the language for our stakeholder meetings. It's community roundtable meetings, or just to be consistent. Okay, there's nothing else. I think you have enough consensus to develop this for next month. Let's go to goal 2.
All right, so executing the grant program. First point, revising the application process and artifacts to further streamline the process. I think that's probably something any organization is going to want to continually be doing. If there's any room for improvement, you want to try and identify those. Insurance service providers report the results using best-in-class metrics. Ray, do you want to add anything on that one?
I guess I was going to talk about that during the open discussion.
Okay.
Go into more detail on that, on how one approach to fulfilling that.
Okay.
There's a goal of prioritizing nonprofit organizations. So I've started to research this concept of the profit versus nonprofit, and I will have a little more of a formal report for that on that for you next month. But to just kind of give you the Cliff Notes version of it, my understanding is that the real difference between a profit and a nonprofit is really the leadership structure. Of a for-profit organization could have been just a single therapist who started a practice and it grew and now they have staff, but they're going after different types of grants. They're going after all kinds of opportunities. They're not making a lot of money. Maybe could even make more money if they switch to a nonprofit format. But it's not really a big revenue generator. They break even. They're able to pay their bills ideally, but the idea that they're for profit does not mean it's like some corporation that's just trying to get people in there. They're still going off of the same funding structures that the nonprofits are. They're going after Medicaid patients. They're using the same schedules and payment amounts. So they're not, jacking up the rates because they're a profit organization. They're going on the same standards. It's just a different leadership structure. So nonprofits, you have an executive, you have a board, and then staff. Some people just don't want to go that route. They might believe that, maybe the board can be prohibitive, or if, they don't, an owner of a business wants to have a little more control sometimes. It's a different structure, but essentially the same mission. So just to give you that concept, if that's something you want to leave in here, that's, obviously up to you, but just so you know, that is something I've been investigating, because that's a question that came up with this last round. And I didn't know the answer, sounds like, oh, they're making money off of, groups like, this board, but that's not the case. They're essentially.
I mean,
Okay,
how do you
throw
know that? So I think the difference is most nonprofits have been, because there's a board and because they're grant-based a lot of times and donation-based, there is a larger transparency that's required and annual reporting and that sort of thing. Are we gonna ask to see the balance sheet of a private owner? Usually private business owners don't share that unless they're publicly traded, correct? So I just wanna make sure that we're getting to see, how do we know that they're not making a lot of money, right? Again, a nonprofit, the board, they're gonna have that in an annual report, whereas a private corporation is usually that's very private. So that's my only, and again, just, I'm not to say whether they are or not, but I would like to know that and make sure it's a level playing field.
Mm-hmm. Yeah, and I'll dig into that avenue specifically more, but I do know they because of federal grants, Medicare, Medicaid, they have to get audited as well. So it's not they're getting money and it just goes into a dark hole. The government wants to know, what did you do with that money? You have to justify every dollar you spend. So, but I will investigate that specific point more.
That's part of our application process, is their financials.
Mhm.
For reviewing that appropriately and can see, how their money is being spent.
What their overhead is.
Yeah.
Okay. I know you got one more goal, one more objective, so go ahead and finish that one there.
Okay, and then evaluating the grant management software to standardize and streamline the application and reporting process. Obviously, that's something I discussed earlier in my report as far as, board maturity and just having, it's what a lot of our peers are using. So I don't know if there's any thoughts on this one as far as,
I think you outlined it pretty well with the maturity to investigate what is being used by our bulk of the neighboring boards, and that just, this objective is in sync with that. Do you have what you need from us as far as the prioritizing nonprofits?
well, I guess for that one, would the consensus be to leave that objective in to prioritize nonprofits, or would you want to kind of wait until you have a little more information to see if that's something you're interested in?
Board members, what do you think?
I've worked for both. Nonprofit is definitely where my heart would be. So
Okay.
there's just a big difference in philosophy for what I've seen. And like I said, I've worked for a small nonprofit and I've worked for a huge television corporation. And I know this is a different genre, but I would still like to prioritize that. But
Okay.
that's something I could evaluate as a board member. It doesn't have to necessarily be a goal of the board. So
Any other feedback?
how I could weigh it.
Okay, I guess I could, my suggestion would be to just leave it in, approving it next month. That can be edited out, or it can be amended out if you guys decide that's more interesting.
Okay. Leave it. All right. Goal 3.
Expanding services in the township. Question was asked, is this still a goal? Is it feasible in this year? Is this more of a long-term goal? So I think that's maybe that's a good place to start, is what is the idea behind expanding services in the township?
I would like to know what kind of services people are saying to expand in the township. So I know somebody gave this input. Now's the time to discuss it.
Well, this was actually a previous goal, but it was kind of
It's like
not
when
well
we're starting
defined.
out, we didn't have any mental health, you know what I mean? We weren't supporting any, so I think it was like, yeah, that was our goal. I still think it's our goal, right? We don't want to certainly shrink it, but.
And I think we changed the name because it was something about a physical location. And so
Right.
that's why
Right.
we changed it to expand versus
Mhm.
setting the goal to having an actual location.
Okay, Member Auger.
Yeah, for me, the differentiation between this goal and the prior one, goal 2, is this is where we're trying to define and develop new ideas that we want to implement for either this year or as a lead into the next year. So, further down, we had a goal 5, which was effectively our long-term goals. And last year, unfortunately, we put a whole laundry list in there and really didn't give much thought to what we were going to do with that. So what I see is going forward, that long-term list is kind of areas that we need to look into for the upcoming year. We pick 1 or 2, and those become the ones that we focus on trying to develop. We find out what the needs of the community are, and then we try to develop those in the next year such that the following year they can become part of the grant program. Much like we're doing with the police social worker program right now. That takes some runway to get that planned.
My
Member
other
Dami?
comment is, I think we are expanding services just by opening the grant to different service providers. Now it's up to them to kind of follow through. So, police social work example, that would be one way to expand it, but if they don't have the capacity to do that right now, then that's not so much on us because we're willing to kind of contribute. I'm thinking of pivotal counseling, they're expanding services to first responders, or at least that's, the hope, and they're starting that, and we're even going to ask or inquire about crisis intervention training. That would be expanding services, maybe not to residents, but to members who have an impact on our residents. And so I think we are actually continuing to work on this.
Okay.
Just something that occurred to me as you guys were discussing this. It says expand services in the township, so it almost sounds like the board itself is expanding the services, but I guess I'm looking at it as like you're facilitating that expansion. So I don't know if that's maybe a language change you would
That
consider.
would be
A wordsmith, it just
Yeah.
needs to be wordsmith.
Mm-hmm. Okay.
a good suggestion.
So facilitate the expansion of services in the township.
Yeah.
That's a great start, yeah.
Okay.
Okay.
And then, so there is that one bullet point, number 1 in red. I'm sorry for folks following along at home. I did not scroll down here. I don't even know if you can read that. It's so small. In the video, I can try and put the image over it so you can see it. My apologies. So determining where service gaps exist, entering in discussions with service providers who might fulfill those services. That's a good objective, and that's kind of what you are
We're already doing that.
undergoing right now.
Right.
These other 3, I guess my staff recommendation would be to scrub them because they're kind of just a carryover from last year's sort of nebulous concept.
I would agree. Does everyone
concur.
agree? Everyone concur? Okay, numbers 2, 3, and 4 are scrubbed,
Okay.
scratched.
Okay.
Any other comments on goal 3? If not, let's go to goal
Question mark.
Yeah, that was my input, and it was really kind of another wording of goal 3. And under there was going to be putting in these 2 goals, which we are working on this year, some of which we have already implemented.
Yeah, so I don't know if you want to leave those in as objectives. They're already at least underway. And Ryan and Kane, certainly you're supporting currently.
Yeah.
In the police social worker program, once that opportunity comes into fruition, I think you're ready to act. So if you want to take this off of there or leave it in, I guess that's the guidance I'd be looking for.
My recommendation would be to put those items 1 and 2 as part of goal 3.
Okay.
Because those are examples of specific things that we did do some investigation on, and we are pursuing, program services there.
It turns into a SMART goal. It's measurable.
Yep.
And that's also, any other comments from board members?
I'm wondering, would there be a way to just have the point where it says like supporting, not in the moment needs, but that's the only wording that comes to mind, but like supporting immediate needs for like providers, so if some other,
Something
communities.
new comes
Yeah.
in.
Something comes in, sure.
They can ask the board and then we can talk about it.
Yep.
Request information, then approve it or decline.
Like unplanned for
Yes.
Yeah.
needs.
Yes.
Okay, so maybe as we merge this with goal 3, support immediate needs, and a couple of sub-objectives would be support and Ride and Cane, support establishment of PSWP, Would that be an example, or am I oversimplifying this?
No, I think that's right. Support immediate unplanned needs. I think I like that.
Okay. You got the direction on that? I think that's.
Yeah,
what I was going.
sorry, my brain is trying to like figure words out, but yeah, I got what you guys.
Okay, got it. All right, any other questions or comments on goal question mark? If not, let's go to goal 4.
Okay, developing the administrative structure, so establishing the information management document centralization. That gets back to utilizing SharePoint, as I discussed during my report. Establishing a comprehensive list. These are all kind of relevant to that conversation. Identifying and implementing policies and procedures needed in FY 2026. Developing and executing a site visit policy. Identifying and creating a list of software and hardware needed to operate the mental health board. I think with number 3, obviously, and 2 and 1, those are part of that CMMI conversation. Developing and executing a site visit policy. I think that is something that you absolutely want to have. That gets into just that level of building trust and allowing board members, even more than building trust, to just see how these organizations operate. You know, there are questions about the for-profit groups. We can set times and meetings, and you get to actually have them walk you through their day-to-day and see what it's like. This is different than an audit policy, an audit procedure, because I know sometimes people think of it as the same thing. Site visit really is for board members to be able to go to these organizations and just, it's touch base, it's relationship building and trust building. Whereas an audit policy, that is where you have staff going into organizations, whether certain ones in your grant program or all of them, and actually going into their books and seeing how they're tracking everything, how they're keeping tabs, how they know they're giving us the correct information when they send us an invoice, beyond their federal audits that they have to conduct every year. So just wanted to make that distinction, because I know sometimes there is that conflating of the two concepts.
So I know we've had this discussion offline when it comes to backup and recovery, disaster recovery. Are you anticipating those are policies that go under this goal, under the policies and procedures needed in fiscal year 26?
Yes.
Just want to make sure we're literally talking that there. Member Auger.
Yeah, for consistency, it might make sense to just strike item 4, develop and execute a site visit policy. While it's important, there's going to be a number of other policies and procedures we want, so to focus on that one might give a incorrect sense of what we really need to do.
Is there a consensus to that? No objections, so okay, you got that direction. Anything else?
And then item 5, I don't know, again, if that's also something that can just kind of be housed underneath one of these other ones.
I think number 5 can be housed under either
Under
2
number
or
1.
3, or 1, actually, that'd be better. It's just, what does an infrastructure look like? What does it contain? And list of software, hardware. That also includes things like service level agreements with vendors who provide the software. But if we get into receiving data from data sources, that's also another case of what that infrastructure will look like from an administrative standpoint, let alone where we're going to store it. And
Okay, so strike that one.
yeah.
Okay.
Any other questions or comments on goal 4? Let's go to goal 5.
Okay, developing long-term goals. So this also just sort of leads into updating the 3-year plan at some point, perhaps even this year. But service gap analysis, all the items underneath that were what were under this goal 5 last year. So I just kind of put them under that concept of the service gap analysis, just ways that we can identify further needs. Mr.
Auger?
Yeah, so what I envisioned was that these 5 items would not show up in the long-term goal 5, but are part of this service gap analysis report. So we keep a running list of what are the things that we or residents, our needs assessment, our roundtable discussions say could be helpful to the community, and we refresh that list on a periodic basis and select from that the ones that are the most important, and we go focus on them for the next year.
I think my question would be, when we talk about a service gap analysis, that could be a specific process that we could even hire somebody to do for us, or more what you're saying is like an organic thing that we're
Yeah.
and some of what I'll bring up when we talk about a potential second round of funding would be part of that, like what I'm getting from service providers, hearing in the community. So I just want to have a little specificity on that, if that is something you guys want to also pursue as far as a more.
Okay, follow up to that?
Yeah, so this, the service gap analysis would be the type of things that we would get more likely from a needs assessment as well. So, that's what would feed that, but we've chosen not to do needs assessments every year.
Mhm.
So on a periodic basis, we're gonna get that needs assessment done, hopefully. But then, in the interim, we're gonna get feedback from different sources to
Okay.
augment that.
Okay, yeah, so not contracting somebody to do an actual gap analysis that,
Right.
has methodologies and all that stuff. Okay.
So let me see if I can replay the input given, make sure you can replay it. Did you say strike numbers 2, 3, 4, and 5 on this draft? Member Ogden?
What I was saying was
A
the
through
A through E, I don't think need to be explicitly
Okay, A
listed
through
because
E.
they are gonna be what's contained in the gap analysis report. And that gap analysis report may, develop into other things as well.
Okay,
So do we need number 1 and number 2? Is number 2 just kind of sum up?
Yeah, well, so number 2 is picking one or
So
more of
doing
the
1
items.
and then doing 2?
Yeah.
Okay, gotcha.
okay.
Maybe make a suggestion for rewording item 1.
Conduct a service gap analysis or like what?
Well, maybe not even using the word gap analysis, but identifying service gaps in the community.
Okay.
Would that
Sure.
be maybe more specific to what we're actually talking about?
And definitely that's where the community roundtables should be
Mm-hmm.
one of many first touch points there. If our agencies can't tell us that, that also gets into what I was discussing with you during the week as far as what type of additional information we can get from the county, because they track this, and we talked about secondary data sources. And for those who were on the board back in 2022, we did have Michael Isaacson demonstrate what the county's community health assessment. And for the mental health board back in October of 2022, we asked what type of data could we possibly use to help us take, pardon the pun, but the pulse of Dundee Township. And that is still something that I would like to be investigated. And that goes under identify services. I think also another deliverable we might want to have here is we do need to update our 3-year strategic plan.
Yep.
So we should have that as an objective in here.
Yep.
Would the board agree or consensus? Hearing no objection, make sure that gets in there.
Okay. So then I guess for the other ones, what would you like to do with items 3, 4, and 5?
I think that's all, with definitely number 3, that's a function of the community roundtables when we have the agencies here. And that can be brought up through the roundtable, through the communications.
Okay, so just all these pretty much can be just incorporated into that main, just identifying the service gaps.
What does the board think?
And number 5, like, isn't the county already doing that? I don't know why we would want to do that.
Something I put in because I wasn't sure if that was a need again, like as a service gap. I know there's other communities that have a free dispensary, either at the police station or in like a place that, again,
Like a
feel-
library or something.
Yeah, like open to the public and less
feel
like
like
intimidating than going to the hospital or.
Okay, say again, number 3?
No, I thought the county was taking the lead on that, but maybe it's just down on that side of town, I don't know.
They're not all over
The
the
health
county.
department.
Yeah, the health department,
Yeah.
they do have some Narcan dispensers that they are stocking. None that are up here that I'm aware of.
Oh, okay.
So
Yeah,
yeah, I guess that would be the question, like,
Is there a need for that?
Community or not, but yeah.
Yeah.
that was just more
Okay.
my own curiosity.
Might be one.
We can find out.
Yeah.
okay, so we can just house all of those underneath that main
Yeah.
objective of identifying service gaps in the community. Okay.
Right. Definitely though, when you put the objective of the 3-year strategic plan, and that's likely going to be in the last half of the fiscal year, that's where I want inputs like how Member Connell suggested 2 or 3 meetings ago, where what types of additional potential revenue sources under current law we could utilize, I think he was along the lines of syntaxes at one point. And I think our 3-year plan would be the more appropriate place to address that. And there are some solutions that we could do, but it's not going to be done in a year. Okay? Any other questions or comments?
Is there anything anybody would want to add to this that wasn't already captured? I know everybody gave their feedback, but just want to make sure there's nothing we're missing. Because then I'll take all of this feedback and put it into a finalized document for your guys' review.
And we'll be up for approval at the April 10th meeting, right?
I mean, just because we talked about it, I'm not saying we need to do it, but the 1099 versus W-2, do we need to put that within the administrative infrastructure? That's like a goal for the next 12 months.
I would say that's part of the administrative infrastructure. If we need to set up an objective, possibly for a conversion to a W-2.
Yeah, or investigating what's needed to.
Correct, because we're already planning to do that starting that with getting some facts from corporate counsel, that's going to come up next month. But yes, that should be on our radar because that should go hand in hand with being level 3.
Okay. Sounds good.
Okay.
So I'll put that
Good
in.
question.
I'll add that in there.
Thank you. All right.
That is it for that discussion.
Well done. This was meant to be a roundtable discussion. I'm glad we had, 7 of us here, and great job. All right. Out of the interest of time, we discussed the upcoming board vacancies last month. There's really nothing new to add except, the plan. I'll be working with Member Thrower in her role as supervisor of, is there interest among the incoming board members to be considered for the appointment at the May 21st meeting, and that's something I will follow up directly with Supervisor Thrower on. All right, moving to new business. Chair will entertain a motion to approve the annual report for fiscal year 2025. Moved by Adame.
Second.
Second by Thrower. Discussion, Mr. Sanchez.
Member Auger did provide some feedback that can be incorporated into the final. I didn't know if you wanted to go through each of those points, Ray, or if just there's a consensus.
But if there's a consensus, I believe I sent them out to everybody.
Yeah, everybody had them, so you could adopt this as well. Should we do it that way then? Adopt it as amended?
Yes, as amended. So take the report as amended?
Yes.
You
Yes,
change your
that's
second?
fine.
Okay. Capture for the minutes, it's
Yeah.
as amended. Okay.
So I guess if there's no other feedback or discussion.
The only other amendment, and this is a minor one, but remember, I want to have a signature comparable to our previous annual report. Sincerely, signature Mark V. Avalar, President, Dundee
In the
Township.
introduction section. Yeah.
Correct. There's no other questions or comments? Please call the roll.
Adame?
Yes.
Auger?
Yes.
Connell?
Yes.
Corns?
Yes.
Thrower?
Yes.
Avalar?
Yes.
It's approved.
Of course, you'll now do with the approval, once you take out the draft words and amend it, then you're going to send it out to the appropriate channels that are required by law.
Yeah, it has to go to the state. It has to go to all of the legislators that represent this area, and I think I sent it to municipalities as well.
Correct, and our local elected officials, so like state
Yeah,
representatives.
local elected officials. All of the
I want to thank and compliment Coordinator Sanchez. This might have set a record for the earliest an annual report has been written, let alone approved, by this mental health board. So again, we're on our way. The fiscal year ended at the end of February. We've approved our annual report. We're getting, some people might say as baby steps, but we're getting close to that level 3. We can quickly turn around important reports that are required by statute. Chair will now entertain a motion to authorize the president to vote on the ACMI bylaws changes at the ACMI meeting of April the 4th, 2025.
I'll make a motion.
Thrower?
Second.
Okay, tiebreaker goes to Connell. Discussion, as those of y'all who saw the ACMI distribution, there have been changes to the bylaws. ACMI, of course, being the Association of Community Mental Health Authorities of Illinois, which we are a member of. We just approved renewing our membership. And most of those changes are perfunctory, but they're beyond the day-to-day. And when either I or Coordinator Sanchez or on occasion President Pro Tem Auger attend the meeting and represent this board, unless it's just routine things like approving minutes, like for instance, I abstain when it's a controversial item that I have not discussed with the board. And the biggest example was 2 years ago over House Bill 475. I abstained, as well as many other mental health boards did, because we haven't consulted the board. And I'm not going to cast a vote for the board, I just abstained. But nobody was in favor of it. And that was the legislation that was going to give levying powers to appointed mental health board members. That did not take place, but that was in the statute approved by the House 2 years ago. So the changes in the bylaws are fairly straightforward and perfunctory. They're more of establishing an executive committee. That's because the brunt of it to manage the day-to-day as an executive committee versus through one person. And I saw nothing wrong with it, unless some of y'all did, but I was just planning to vote in favor of it officially at the meeting on April 4th, which I will be at in person. Any other discussion, question?
Just clarification. So we're authorizing you to approve the bylaws changes. We're not authorizing you to slip on behalf of the Dundee Township 708 Board for legislative matters.
Correct. That is correct. Any other questions or discussion? If not, Secretary, please call the roll.
Dame?
Yes.
Auger?
Yes.
Connell?
Yes.
Corrins?
Yes.
Thrower?
Yes.
Avalar?
Yes.
Approved.
Okay, moving to discussion of a second round of grant funding.
Okay, I will refer back to my presentation. So this is something, when I created the projections for the next couple years of funding and our justification for pursuing the same levy amount, because there's programmatic opportunities out there. This was something that I included based on some of the feedback that I've gotten from roundtables, from talking to service providers and members of the community. So I just wanted to kind of walk you through this, see what your thoughts are, if this is something you would want to go after. So let me just kind of do that. Obviously, we have a fund balance, so there is some money that you can allocate at any time. I think right now we're at 300 and something, but as the tax collection comes in, there will be even more. So if you were to approve this amount here, you would still have enough fund balance for any emergencies or unforeseen things going forward. So just the concept I created was the idea of $200,000 for specific categories, and these are the three that have come up the most: teen mental health services, adults with disabilities, and homeless residents. So for teen mental health services, that's something that's definitely come forward from service providers. There's certainly a need for direct services for teens, but also inside of the schools. Schools have counselors, they have staffed psychologists, but they're not always able to meet the need. It's more kind of a triage. They're seeing the students who really demonstrate the most need for those services. But as we all kind of know, even just as members of the community, teen mental health is a very, very large, up-and-coming, and concerning topic. So I have had some initial conversations with people in school districts and some service providers. And so I think if you wanted to go in this direction, we would just have some more of those conversations to really see what the direct path is. But the need is there, the desire is there on both sides, school district and service providers. So in any case, that it will be an ongoing topic of discussion. Adults with disabilities, that's also something that has come up many times. There is the concept of the PUNS list, and what that is essentially is when disabled residents age out of the initial funding they have as minors, they are put on this list as adults for services, I believe, from primarily federal sources. But when I looked at the wait list information, it was showing about 2 to 4 years for people to be on that wait list. And once they get approved, the programming is very expensive, could be anywhere up to $100,000 per person per year. So not something that really is going to be in the realm of this mental health board as far as funding is concerned. But in talking to service providers, respite care was identified as highly needed for these families because you have parents who are still taking care of their adult children who have the same needs at 25 as they did at 15, at 5, and they experience a lot of stress, a lot of burnout. We do have the NISRA respite program, which I was just at an event last night at the Dundee Township Park District, and their van is parked right there in the parking lot. So again, just another sign that they are very active. But their programming only covers so much, and it only is the Park District programs. So some of the other respite care concepts might be, okay, we have somebody that comes in and stays with your disabled child, and you and your husband or your wife or whoever, you can go out to have a meal by yourself and not have to worry that your child is going to have some needs. You can go to the movies, just any little things like that they're allowed to be able to do only because somebody is stepping in to help them. So that was something that came up quite a bit. And then the homeless population, just something, I know with the township, they've been in a lot of conversations with the local police departments because sometimes you have homeless residents who are camping out in, forest preserves and open space areas. We've all seen people that you could tell were just living outside. I know there was a program request a couple years ago that got cut or removed from consideration that was going to create, I believe, a caseworker that would go to the homeless population, really develop relationships with them, make sure they're being not monitored, but they're being looked after, making sure if they need services, they get to them. If they need services and don't want them, try and persuade them to get into those services, and when they're ready, connect them to those needs. There's obviously Elgin has a much more robust program and offerings. They have certain churches and things like Pads of Elgin and all those great things they have in Elgin. So you do have some of the homeless population that travels back and forth, but they're not able to meet the needs that they have just with Elgin residents in Elgin. And the recent tent city fire is a good example. If the county didn't have some COVID funding available to provide pads, the city would have had to come up with $400,000 or $500,000 to house all of those residents as they are now in hotels. And would they have had that money, or would have created some undue burden on their budget and the taxpayers? So again, just there's still a need to be met there in the homeless population. So I know Member Auger has something he's going to go over as far as standardizing outcome measures and improving that aspect of our grant program. What I'm conceptualizing here can happen before that. So that's something in the next full grant program, we can implement those updated documents. But for now, we can be on a more compressed timeline and utilize what we have currently, what we use for this current grant year's program. And then the idea being to put this on a July to June timeline. Even though, if we go in this direction with all the approvals, the NOFO, the contracts, the work plan, I know we can move more quickly on this, but we'd want to make it probably more retroactive to July and then have it that July to June timeline. What that does is provides an opportunity, if this board so chooses, is to move the main grant program timeline to that July to June timeline. The benefits of that would be that it aligns with the state's fiscal year. There are a lot of service agencies that have that same fiscal year because of that. But then for this board specifically, because you're aligned with the township's fiscal year, you currently have a 4-month gap period at the beginning of your fiscal year where you don't have any money coming in. So if you don't have money in reserve, there's that complication of, well, we have services that we need to still provide that are contractual. But we don't have that. We don't have the problem of no reserve right now. There is a healthy fund balance that you have, but that is going to dwindle. That is obviously the goal. So you just wouldn't have to build that into your budget if your main grant program. So that's just something for you guys to consider, just putting that thought in your head going forward into the future. It's not a requirement. This is just the simple concept of a specific round 2. So that's all that I have. I'd open up to any thoughts, questions.
Okay, board, Member Auger?
So going back a slide, you had suggested a budget of $200,000 for this second round of grant funding.
Mm-hmm.
Is that in lieu of money that we would use for the police social worker program, or is this in addition to
This would be
that?
separate from that.
So that money would still technically be there to pursue that goal
Yes.
if we,
Yeah.
okay,
Okay, so it's in addition to.
Yeah.
all right.
Yeah, you currently, I would have to refer to the financial report, you have 300-some thousand as a fund balance that's unallocated, but as the tax collection season begins in June, that amount is gonna rise significantly. Or not significantly, but it's gonna go up, so we can absorb both programs certainly.
Okay.
And that was part of the projections that I created as well, that both would be able to occur.
Any other questions from the board? Comments? Member Adame?
Are there service providers who are currently saying they need more money or money, period, for the items listed here?
Yeah, yeah.
Okay, so it wouldn't necessarily be us like doing some outreach and saying, we want to provide help in these areas, come and talk to us, or?
Yeah, it's because I know there are service providers that have expressed the desire to expand services in this way. So that it would seem to make sense to me that there are probably others as well that are looking to do the same things. I haven't talked to all the 55 or however many in the area, but yeah, it has been expressed.
Member Auger?
Can you elaborate on what service providers have provided this input to us?
Well, yeah, I mean, AID is one of them. Ecker, I guess I would shy away from that a little bit because I don't want it to seem like we're creating a grant opportunity for specific providers because you want it to be a fair process.
Right.
But I mean, AID had a program for homeless caseworker previously a couple years ago, so that was something
That's
that
submitted to us.
was submitted to this board.
This is going back to.
It was
Okay.
the first
Before-
grant year.
Before you were on the board.
Yeah,
All
But
right.
then didn't we give AID money and then they didn't use it?
it was for a different program.
Okay.
And then they had lost that staff person, and because in this field, mental health staffing is very difficult, so they weren't able to find anybody in time and had to.
Okay, I'm for second round because again, I think we are still trying to figure out what the appropriate amount of levy is. And if we wait and then we have like even more money left over next year, it just makes it hard for the board of trustees to determine, right? Like, I know there's a push, there's a contingency out there, oh, we want more, and it's like, the current board is like, well, we're seeing that it's actually should be less. So I think the more we can do to try to get this out there, it helps the argument for no, we are at an appropriate amount, or we might need a little more, it just helps us be able to tweak and determine where we really need to be. So the sooner we can do it, the better.
Agreed.
Okay.
Member Adame?
I think a great approach would be to kind of reach out to the list that you have and say, we have a need in these areas. These have been identified needs, and whoever comes back and says, we have a matching need and we need money, that would be one way to go about it. So it doesn't feel like we're targeting a specific provider and we're just creating, a grant for them, if we want to be fair.
That is a route that you could take. So it would be a non-competitive type grant. With a competitive grant, you want that fairness aspect to be paramount. And that's when you get into providing a NOFO that goes out publicly and you just see who comes in. So that's that competitive type grant. If we were to go that route and more non-competitive, letting them self-identify to us, and then they can express how much they need, and then we can compile that all together and then chop things down if we need to, or determine, we don't want to go with that agent. You could make those decisions at that time.
Member Auger?
If I heard that right, non-competitive, that concerns me. I think we'd be setting perhaps a bad precedent if we're making non-competitive. I think we need to open it up to all of the service providers, identifying if we have specific areas that we want to target, that's fine. But I think it has to go out to everybody.
And again, it should say, here are the areas that we are concentrated on, but obviously there might be something that none of us are even thinking of that is a huge need that has developed in the, since we opened this up last time. So I think if we say, here's the areas, I think most grants do that, area of focus, but leave it open that anybody can apply.
I recognize we're talking, Member Connolly has something to say? Okay. I recognize we're talking more conceptual here, but just a brief touch on the process. Were you anticipating, if you have your consensus now, to float this at the April roundtable or probably the July roundtable?
If there's consensus to move in this direction, then we can just move into preparation of a NOFO that can be presented at the next meeting. And if that is approved, then the grant cycle would be open.
Next meeting, okay, so next meeting of this mental health board
Yeah.
on April the 10th.
Mhm.
Okay.
So we could have an April meeting just for that one thing, and that's it. I know, we were joking earlier about, oh, maybe we don't need an April meeting if it's kind of quiet.
Okay,
But
well, is there a consensus? Looking to the board, is there a consensus?
Like I said, I'm for it. I would love to see.
So, everybody's nodding their head. I think you have your consensus.
Okay.
Obviously, I want the one-year plan. One-year plan's a higher priority.
Mhm.
So if one-year plan's at risk, then it has to be the May meeting when we discuss.
Yeah, I'll start with that, complete that, send that out, and then I'll get to the NOFO, and I'll work with you and Member Auger and burn some midnight oil. And I do think, we can move quick, because we just did it. We just did it, and we kind of have the lessons from that, and
It's a good test
we
to
can move
see if
quickly.
we're getting close to level 3, if you can quickly do it versus.
There you go.
Either way. All right, thank you. Thank you. We have no need for executive session, and hence we have no need for a follow-up from executive session. So now we're going to move to board discussion. Member Auger will go last of the board discussion. I want to hear from the rest of the board, starting with Member Connell.
I have nothing.
Nothing?
Nothing.
Member Adame.
The only thing I want to bring up in terms of like the goals, is how we can support Jared a little bit more. I kind of like to maybe take a lead or a sub-lead on some of these goals. For example, communication. What can I do to help facilitate information that I have for it to go out to the public, so you're not the only one spending on doing the research, right? We all have knowledge and different skill sets, and I think we could utilize to kind of push forward some of these goals. So it's not so much of like, we need to just focus on this because there's no bandwidth to focus on the other at the same time, if that makes sense. So that's just something I'm bringing up. Like I said last time, use the skills that I have to progress on these goals. If there's a way, I'd love to.
Listen, go ahead, Member.
Yeah, if I could
Coordinator.
respond to that. Yeah, I think that is a good idea. And so, like as I said, I'm starting to finally use some project management software to help, because this is only growing and becoming more complex. So I need to be much more strategic with my time. And then that will also help to identify where board members could help fill in or, take some tasks. I know Member Auger has been very, very involved in doing some of those things. So going forward, as we develop our timelines and stuff, I think definitely there's going to be many opportunities for that kind of involvement. Yeah.
Good. Anything else, Member Adame? Member Thrower?
So I just wanted to make sure that I could also get a copy of the annual report if it's finalized before the board meeting, because we can share that with the board of trustees. I know it will be posted on the website too, but just like if I could get a hard copy.
Okay. The progression will be, once the amended changes are made, then I'll sign it.
Okay.
And then at that point, it's official, and then hopefully we can have that for your meeting next week. And obviously, the big meeting is the annual meeting
Yes.
on April 8th.
Yes.
So we'll
And
be able to
we could
share
just
the.
even as long as we mention it to the township board.
Okay, yeah, and definitely give it for them, their review in hard copy, no question.
Okay.
Anything else, Member Thrower?
Yes, and not to be awkward about this, but I know you're going down to Act 9. And I know you had mentioned you were going to do that, using some points or on your own accord or whatever. And I just absolutely, this board, we have the money to pay for all travel expenses, and I just don't want to set up a precedent. While it's super generous of you to offer that, the next president may not be able to do that. So I just want to make sure that when we are sending our people out for training, all that thing, that mileage, everything, that's covered. That's just, so again, you're very generous and sweet to offer that, but I just want to make sure that for future boards that would not be an expectation. And I also would like for this board to purchase a laptop for the president, because I know, again, there's a lot of communications that are coming back and forth, and that laptop would travel if you were not the president in the future. That's, it's township property, but I just feel like, as things are getting more robust. I think that's important. The staff all has one, Administrator Sanchez does, but even our clerk, that sort of thing. So there's just so many business communications. I hate for you to be using your own stuff. So again, it's kind of awkward. I don't know if we need a consensus on that or if we can just move forward, but I just want to make sure that.
It is budgeted, so we don't need an action item on the agenda. So if there's a
Okay.
consensus here, then we can
And
order it
I
up.
think we have of the $5,000, we have $4,000 left for travel and we have money left in commodities. So it's okay.
We have a technology line item that we haven't
Oh,
touched, so.
okay. So I just feel like let's,
Okay.
Yeah.
so.
Well, I don't want to set a bad precedent. It's just that.
No, you're not, it's not like you're going to Hawaii or you're going down to Springfield. I just want to make sure.
Is there a Hawaii conference? Because everybody's
So,
gonna
and-
pitch in.
And also, we do have 2 township vehicles that they are the assessor, but that's often what I will use. If it's not available, then, you put in your mileage for your vehicle. I just want to make sure you guys know that, but
Okay, thank you.
but thank you.
All right, nothing else, Member Throw?
No, thank you.
Member Corns? All right, now we'll turn to Member Auger, and we're going to be talking about the deck, the hard copy deck that he passed out. Is there a soft copy for the?
There was a soft copy that was sent out. Okay, so I want to thank Member Adame
Wait,
both.
hold,
for-
time out. What was that? There was a soft copy?
Ray had emailed,
Yeah,
but this has some additional. Do you want me to pull it up on the?
If you want,
call.
it's not, this is gonna be pretty quick. I'm not gonna
Okay,
go through all
yeah.
the pages. This is more for background for people.
Okay, that makes sense. Go ahead.
I don't want to celebrate another birthday
the
going through
font.
this before.
I know, it's like, ooh, we're going through.
I
But-
can actually read it.
You did. Oh, I see you marked it up. Anyways, Member Adame made a good lead into what I'm asking here. What I am proposing is we contact our neighbors to the north at McHenry County Mental Health Board to learn from some of their best practices. They had done a presentation at the December membership meeting on standardizing outcome measures. That was clearly an area that we had some discussion on in terms of what we put into the work plans. They have done a lot of work in this area since they're due to the years of experience and their size. And I was hoping we might be able to leverage what they're doing. And to that end, I had put a list of questions together. So I wanted to make sure that the board was aware of those. And the big ask, does anybody want to help me with this? I would set up the meeting and
I don't know. Can I get back to you after April 1st?
I can go by myself.
We got a lot of
I
work.
can go by myself.
We got a lot of
but
work right now.
Member Adame, you were talking
How
about
soon
using your
I was
expertise.
gonna get it, especially now that we're talking about going into another round of granting. I think we should hop right on this. My intent would be I'd call up the staff up there
Okay.
tomorrow and see if we can set something up in the near future.
I'm available. I can help you. I was gonna say.
Member
I know-
Adame, hold on.
Yeah.
You're also available too?
Yeah, I
Oh,
think
yeah,
there's
but
a,
depending on timing, obviously,
Yeah.
availability.
Because of the limitations of the Open Meetings Act, it can only be one of y'all, so, and I do not plan to go. So, y'all decide, flip a coin. Anyone else interested in this? Okay, go ahead.
I think if you set up an appointment and then we figure out when, even if I could do it remotely, like over
Yeah.
the phone, I can certainly be available.
okay, be
Okay,
happy to work with you.
Member Throw is a
And
potential,
McHenry, they'll be down there in Springfield, so, that group, so.
that's true, they'll be there.
Somebody from there will be.
Yeah.
But I don't know. We wouldn't have time for this conversation.
No.
Yeah.
Yeah.
But certainly,
And
I
I'd
just
like to
want,
be a part of that too.
but-
Yeah,
Yeah.
I was assuming you would be,
I'm
but,
not a member, but obviously.
but have you, so you have the direction you need?
yep, that's what I was just looking for, awareness and somebody to volunteer to help.
Very good. Thank you. All right. There's nothing else. We're going to move to the president's report, and that'll be brief, especially in interest of time. As the annual report is socialized into the community through all the channels that are required, including the website, I worked with Coordinator Sanchez to ensure that the full context of the Dundee Township Mental Health Board and what was approved nearly 5 years ago is reflected going forward, because from all over the place, there's been some misinformation, and something one has to remember is that when the referendum was approved, and, you know, like the 62% of the people who voted for it, I voted for it, the laws at the time is a point in time, and those laws have changed. That's impacted us directly. There have also been some threats, which we've worked through our channels. You know, remember, I'm sure you remember 2 years ago, we were working on stopping that, you know, unelected officials setting levies. And that's just one of many examples of laws that have changed. So took the opportunity of the annual report. First off, the legislative action that validated this board to be able to do a levy was done through a public act, and it was signed into law in mid-2022. That's why the first levy for this board was at the end of 2022. And because of issues with the tax cap, and litigation was initiated by the previous board and continued by the current board, township board, and the ruling came out, and then that was in 2021, and then in 2022, working through the legislators. Definitely my predecessor did this more as the mental health board president, and Public Act number 102-0839 was signed into law, and that's how we even had our first levy. And so it's explained in a little detail. I kept it high altitude. But additional changes to the Community Mental Health Act. There have been 4 changes to the Community Mental Health Act since the referendum was approved. And several of them impacted us directly. But other laws, particularly the Generally Accepted Standards of Behavioral Health Care Act of 2021, or Public Act 102-0579, was very significant. That's the law that mandated mental health coverage through insurance. Through all Illinois, it required all Illinois-based plans to be covering mental health. Now that was to be implemented on January 1st of 2023, but as our metrics, this is one reason this board has pursued metrics from our providers above and beyond the standard, we didn't see this law fully be implemented until the end of 2023. So there was a 10 to 11 month lag. And just because a law says January 1st, when are our patients in Dundee Township benefiting from that law? And that's one of many reasons why we emphasize metrics and reporting with all of our agencies. But, you know, Family Service Association of Greater Elgin, it was terrific. I remember them telling me back in 2023, we've never done this before. Well, let's do this for our patients here. And if this can be reapplied elsewhere, let's do that too. But also, that drop, the trend that we saw, and as Coordinator Sanchez reported during the financials, that's a trend we're still seeing. And it is one that is impacted the community, but it's impacted the community more in a positive because now these laws that are being passed in Springfield are actually working for the benefit of our patients. So uninsured should be a thing of the past. There's still a challenge of underinsured, but the state's made its progress, even though it's been slow. And finally, another law that took effect at the start of this year, the Mental Health and Wellness Act, Public Act 103-0575, mandates all insurance carriers to cover mental health and wellness exams, an annual exam. Now, that's up to the parents when it comes to children, but that's now an option, just like you have a physical exam. Now you get a mental health screening if the insured so asks for it. So these are, now, what can we as a mental health board do with that? Well, one, we could put some communication on the website saying, as a reminder, do you know you have this? If you want to take advantage of this, take advantage of this. That's one of the visions where this mental health board, to serve our residents, we can be as proactive as possible and not being reactive. But then let's look at what happened just last year. The Healthcare Protection Act, Public Act 103-650. That ends step therapy, that it solidified the doctor-patient relationship when it comes to medications, where the insurance companies had control and mandated go through step therapy basically with meds on their formulary before you get to what will actually help the patient. That has been removed, and but that's not fully implemented until July of this year. So what I'm trying to point is that the context that our mental health board being approved, and it was great that the voters approved this by 62%, but the context that we're in is constantly changing. And Coordinator Sanchez keeps on top of this through our participation with ACMI through the legislative process, and that's what the ACMI meeting in Springfield is about policy, legislation, and what changes we could have. And now they're likely going to do a reform of the pharmacy benefits managers. Anything that impacts our patients, our residents, having access to meds for their therapy services, by all means, we're keeping an eye on that. And if that expands the needs for funding for agencies in the future, for instance, if the doctor-patient says you have to use a brand name versus a generic, then that's something that this board can be aware of. So I wanted to ensure that this is set in full context and to prevent all the misinformation, because I've seen it from all sides of the political spectrum. Just this past Sunday, something was sent out which challenges mental health boards. And the facts are, we're not the only mental health board who, in some cases, have an overabundance of funds, even with the levy that we adopted. Coordinator Sanchez brought up at last month's township board meeting, the Will County Board. They could have levied up to $18 million when they approved their referendum in 2022. Now, Will County is the largest population, nearly 700,000 residents with a countywide mental health board. Their first levy was for $10 million. And that was still when the tax cap applied. Now the tax cap's been removed from the mental health levies for any government entity who levies a mental health property tax. They cut their levy by 20% at the end of 2024. They're still in startup mode. Like us, we have a balance, but that's not going to last long term. And they see that need too. But there were some who were pushing to have their levy cut by as much as 80%. So their county board did the right thing for their community. Our township board has done the right thing for the community based on facts and metrics. And I just want everyone to know that we try to do a better job of communicating this. We're going to do better on the communication side in the next year. But there's just been too much people questioning that, are we meeting the needs of the community? Yes, we are. We have metrics that says the number of lives, nearly 1,000 lives, that this board has done and we only started funding agencies in mid-2023. So this board has been terrific to work with, and we've definitely had the support of our governing board. There's been some disagreement, fair enough, but we've done the right thing, and we're going to continue to do that and make it even better. So I just wanted to address this, and now that the annual report is approved, this will be building up what will be in the annual meeting for the electors. And for any other communication that we need to do, we can point to this fact that here are the facts. Here are the laws, and if the laws change, we are proactively responding it, not reactively, and it's all on our radar screen. That's why we participate in legislative committee meetings of ACMI. That's why we participate in conferences, and we do ask our questions, and if we see our neighboring boards having a challenge with this, we learn from them, and they can learn from us. So I didn't mean to speak too long, but I just want to ensure that the community that we are serving, our residents, and with the changing landscape around us, we will serve our residents the best way we can, no matter what Springfield throws at us. Springfield throws some curves at people too, and curves that people didn't even think of. So with that, thank you for allowing me to bring this up. Certainly I encourage the community to read the annual report, including the changing landscape, and have those details at your fingertip, because we live this. We know our patients live this, and we want to help our patients respond to whatever changes come their way in a positive way that benefits the patients and benefits the families of Dundee Township. So with that, Chair will entertain a motion to adjourn.
I'll move.
Moved by Auger, second by Connell. All those support signify by saying aye.
Aye.
All opposed, same sign. Adjourned.